Before we begin the course, please take a moment to review this important notice. After you've reviewed the notice, click the Next button to continue.
Course description. Many residents in assisted living or residential care are able to walk or remain mobile with the use of ambulatory aids. Ambulatory aids are devices that residents use to help them move safely and independently. The common ambulatory aids used in assisted living and residential care that we discuss are wheelchairs, scooters, walkers, canes, crutches, and gait belts. We learn about the different types of devices, how they should be used in a safe manner, and ways that direct care staff can assist the resident with the use of the device. Course objectives. By the end of the course, the participant will be able to explain the use of each of the common mobility devices, name 5 suggestions for assisting a resident when in a wheelchair, discuss major safety considerations for residents in a wheelchair, contrast the differences between an electric wheelchair and a mobility scooter, discuss the different types of walkers, describe safety considerations for residents who use a walker. Name the benefits of a quad cane versus a single point cane, describe safety considerations for residents who use a cane, briefly describe 2 types of crutches, explain how direct care staff should safely use a gait belt when assisting a resident, and briefly describe how to practice back safety when lifting an object or transferring a resident. Course outline. Types, proper use, and safety tips for each of the following mobility devices: wheelchairs, scooters, walkers, canes, crutches, gait belts, and back safety tips. This course contains information in several short videos. The content contained in the videos is in addition to the written text. It's strongly recommended that you have speakers on when viewing the videos. The text in this course is also narrated. You will need to have your speakers on if you wish to hear the narrator read and comment on the text material. Terminology used in this course. Several terms related to resident care are used throughout this course. While most of these terms are commonly accepted in the industry, there is some variation from state to state and within different organizations. For ease of reading, we use commonly used terms in this course and clarify below the equivalent terms used in other states. Community. The term community, using a capital C, is used to describe the assisted living residential care setting. The terms facility, agency, or others are used in state regulation. We use the term community to emphasize the home-like atmosphere of the care setting. Administrator. The term administrator is used to describe the person responsible for the everyday management decisions in the community. In many states, this individual is referred to as manager or operator. Direct care staff or caregiver. This is the person providing the direct care to residents. Although there are exceptions, typically this person is not a licensed medical professional. Resident. The resident is the individual receiving care. In other healthcare settings, the term patient or client may be used. Special considerations. This course will discuss a wide range of common mobility devices. For each of the devices discussed, the following considerations are paramount. The resident should always carefully follow the instructions provided by his or her physician or therapist for use of his or her mobility device. Any general use and/or recommendations presented in this course does not supersede the instructions a resident has received from his or her healthcare professional. Always follow your community's specific policy and procedures for the assistance of residents and use of their mobility devices.
Let's talk for a moment about quizzes and what we call check for understanding. At the end of each module are a few quiz questions to help test your knowledge of the module content. You must complete the quiz before you can move on to the next module. Think of these as short learning activities that do not affect your final score in the course.
Introduction. Many residents in your assisted living or residential care communities will use a mobility device to help them safely move about to the dining room, activities, visit with other residents, move about their room, etc. Direct care staff assist residents to help them remain as independent as possible. Before we talk about the different types of mobility devices individually, let's take a look at some general recommendations and fundamentals of care that apply to all mobility devices commonly used by our residents.
Residents living in our communities are often prescribed wheelchairs and other mobility devices. It is our job to make sure that our residents are using their devices appropriately and safely. Some residents will simply require reminding. Remember, Mr. Smith, to use your walker on your way to the dining room is good enough. However, some residents will require full assistance. Always review your resident-specific service plan to be sure that you are providing the appropriate level of assistance with their mobility devices. Let's review some care fundamentals associated with the use of wheelchairs, walkers, and canes. First off, never prescribe the use of a wheelchair, walker, cane, or other device for a resident. That is the role of the physician. While it may be tempting to allow a resident to use someone else's walker, etc., just for a few minutes, you may be setting up a very dangerous situation. Mobility devices and wheelchairs need to be prescribed by the physician. And once they're prescribed, the resident needs to learn how to properly use these devices. So they will often have training from a physical therapist that may even visit your community. Be sure to ask questions about your residents' individual devices so you understand how to properly assist. If you notice that your resident has a change in the way they're ambulating, by all means, report this to your supervisor. It could be a medical condition that requires intervention. If indeed your resident will now require the use of a mobility device, then the physician will order such a device. Of course, the resident will need instruction on the use of this device. It is our job as a caregiver to remind the resident and provide assistance. However, it is not our role to train a resident on a new mobility device. That requires a medical professional. If your resident requires more than simply reminders to use their mobility devices, you will want to clearly understand how to assist with the device. Mobility devices vary by manufacturer and, of course, by resident need. So always ask your supervisor for clear instructions for assistance with the mobility device that your resident is using. It's important that we store the mobility devices appropriately. It's always a good idea to have the resident's name applied to their walker, cane, etc. Store the device in the resident's own room as appropriate. If a resident gets up independently, you will always want to make sure that that mobility device is within easy reach, so they don't have to ambulate a distance without it. You know, one area of concern we have is in our dining rooms. When you have one dining room with many residents using mobility devices, it can also get cramped and crowded. So oftentimes we will store their walkers, etc., off to the side of the dining room while the resident is enjoying their meal. That's fine, but we never want to leave the room unattended when we have removed their mobility devices. We always want a staff person nearby ready to retrieve the mobility device for the resident upon their request. Now, this is particularly true for persons with dementia because they may not think to ask for the device in advance. You may just notice that they're starting to get up out of their chair. That's an indicator we had best go get their mobility device right away.
Wheelchairs. A wheelchair is simply a chair with large wheels especially designed to assist persons who need to sit in a chair to ambulate. Many types of wheelchairs exist to accommodate the needs of the disabled person, including manual or electric, small or large, specialty chairs, and others. Here's some examples of wheelchairs. Manual wheelchairs require the resident to either push him or herself or requires the assistance of another person to push. Power wheelchairs are battery operated. These are generally operated by a joystick. They are highly maneuverable and turn very sharply, so are a good choice for indoors. Small and lightweight wheelchairs are available to fit small persons and children, and some are lightweight for easy transportation. Heavy and sturdy wheelchairs are made heavy and wide to support larger people. Specialty wheelchairs, such as hemi-chairs, which are lower to the floor than standard chairs, allowing the person to propel the chair using leg strength. Other specialty chairs recline, may have head or limb support, or other special needs. Take a look at some of these other specialty wheelchairs. There's the tank chair wheelchair, a beach wheelchair, and even racing wheelchairs. As you can see, each wheelchair has a purpose and function. For example, the tank chair would be very difficult to transport for simple grocery shopping. The goal with any mobility device, including a wheelchair, is to enhance the independence and quality of life of the user. It's always important to encourage residents to maintain their independence as much as possible. This also means direct care staff should take the time to escort a resident using his or her walker, rather than telling a resident to sit in a wheelchair because it's faster for staff to get the resident to the destination. Accessories. In addition to the different types of wheelchairs, a wide variety of wheelchair accessories exist to accommodate the individual. Some examples are supports for feet, legs, arms, or neck, trays and racks, oxygen tank holders, seat belts, brakes, foam or inflatable seat cushions, and many other accessories are available, even fishing pole holders.
Let's talk about wheelchair use. Oftentimes residents are prescribed a wheelchair either for part-time use or full-time use. Some residents will only use their wheelchair, for example, when they are out of doors or traveling long distances. Now, I know as a care provider it can be very tempting to use the wheelchair at all times. Let's be perfectly honest. We can have a resident escorted from their room to the dining room much more quickly if we're scooting them along in that wheelchair as opposed to walking with them as they take their time with a walker. But think for a moment, what's best for the resident? In most instances, it is best that the resident always ambulate as much as possible according to physician orders. So never be tempted to overuse a wheelchair. You're only deconditioning and potentially limiting the future ability of that resident to ambulate. As a professional caregiver, we will want to make this transport as positive an experience as possible. Let's begin with explaining to the resident where we're going in the wheelchair. Nothing can be more confusing or frightening, especially to a person with dementia, than to simply be placed in a wheelchair and wheeled away. So always engage the resident in friendly conversation, letting them know where you're going to go to. Once the resident is seated in the wheelchair, again, it's a nice time for one-on-one conversation with that resident as you're traveling about the community. Now be sure to keep safety in mind. For example, when exiting the resident's room into a busy hallway, you may prefer to turn around and exit backwards so that you're not just shoving the resident out into a busy hallway without having clear vision of what may be coming one direction or another. As you go through narrow areas or especially doorways, be sure to remind the resident to tuck their arms in so that they don't bruise or have a skin tear on an elbow that catches a doorway. You will always want to keep your head up and alert, scanning the area for any hazards, a mop bucket, or anything that might be in the way of the resident. Now keep a good, safe distance between the wheelchair and other residents who are ambulating. If we inch too close, it can frighten the other resident and cause them to become unstable. We never want to infringe upon the space of other residents ambulating in the community. So take your time. There's nothing wrong to pause for a few moments and chat with your resident while others move out of the way. When going around a corner, always check for clearance. And don't take those corners too rapidly. It can be very frightening for the resident and could even result in an accident. Always use footrests appropriately. We never want to be pushing a resident along and having their feet or their heels dragging the ground. Some residents have wheelchairs that are a little bit lower and designed for them to self-propel. They do not use footrests, but rather they scoot themselves along the community, moving about as they wish. Whenever a resident is self-propelling, you will always want to make sure that you survey the scene for safety. Are there any stairs or uneven areas that could pose a danger? Also, be careful of residents that tend to scoot back on their own in a wheelchair. They could easily tumble down a stairway or any uneven area that is nearby. Be sure there are no cords, rugs, etc., again, that could pose a danger when the resident is self-propelling. Residents with dementia will require special monitoring. They may try to get out of their wheelchair in an unsafe manner, or they may unlock the wheels when you are unaware. Always try to position residents with dementia in a line of sight so that you can see them at all times. Sometimes other residents can actually pose a danger to the person in a wheelchair. We will want to remind residents that it's our job to move residents about the community.
Wheelchair safety tips. The most important safety feature on a wheelchair is the brakes. Check the brakes on a regular basis to make sure they are working properly. If not, be sure to call for a repair. Good brakes are needed when a user is transferring into or out of a wheelchair. If the brakes are not working well, the chair could move and cause the resident to lose balance and actually fall. Secondly, stability and balance is important to use a wheelchair safely. In order to ensure stability and balance, there are some simple rules to follow. A resident should not lean forward in front of the armrest, such as not trying to pick up objects on the floor between his or her feet. Residents should not reach backwards or to the side. All of these moves can cause a wheelchair to tip over. Unless specifically designed, a resident should not attempt to go over curbs, obstacles, or sideway inclines unless assistance is available to help. Steep slopes can also be dangerous. If a person is not strong enough, the wheelchair could become out of control on a slope. Wheelchair assistance. When assisting a resident who is in a wheelchair, here are some simple rules to follow. Always ask the wheelchair user if you can help. Do not assume that the resident wants or needs your help. Do not automatically grab a wheelchair and do what you think will help. Not only could your actions cause a wheelchair user to lose his or her balance, it could also be embarrassing. Always allow residents to be as independent as possible and maintain their dignity. Listen to instructions. If your offer to help is accepted, ask the wheelchair user to explain what actions would be helpful. If you do not understand or are uncertain about any of the instructions, clarify before proceeding with any assistance. If the resident is unable to communicate, be sure to inform him or her of each step you are doing. Maintain communication with the person in the wheelchair so he or she knows what you're doing. The resident should always maintain good body posture and avoid sudden movements if the direct care staff is moving the resident over a curb or a rough threshold, for example. Be aware of obstacles and the best path for the wheelchair. Look for other residents, ramps, accessibility, and check the width of the pathways. Never tip a wheelchair unless two people are available to assist. Do not touch or lean on a person's wheelchair without consent. The wheelchair is part of that person's personal space and should be respected. More things to consider when assisting with a wheelchair. If you're assisting a wheelchair user with transferring from his wheelchair to a chair or other location, do not move the wheelchair out of reaching distance. Ask the wheelchair user first before moving it. Before moving a resident who is sitting in a wheelchair, be sure the footrests are down and the resident has securely placed his or her feet on the rest. Before transferring a resident into or out of a stationary wheelchair, make sure the footrests are up or removed and out of the way. Also, make sure the brakes are securely locked. When transporting a resident through a narrow doorway or opening, make sure the resident has his or her arms and hands within the chair to prevent bumping or scraping the resident's skin. Power wheelchairs. Manual wheelchairs work well for people who have the strength to ambulate in them and or have assistance to push when needed. But if the resident cannot do the above, then a power wheelchair is an alternative. Power or electric wheelchairs are good choices for people who are primarily alone with no one to help push a manual wheelchair, and also for people who lack arm strength to propel a manual wheelchair themselves. Assisting with wheelchairs. Before we leave this section on wheelchairs, watch this 3-minute video on special considerations for persons who are completely dependent on the use of a wheelchair. Click on the play button to the right to start the video.
Let's talk about the special care of residents who are completely dependent upon the use of a wheelchair. Let's first recognize that it is never appropriate that a resident is in a wheelchair for extremely long periods of time. For example, if you wheel a resident to an activity and they are able to safely transfer to the sofa or other comfortable chair, do so. You can imagine yourself sitting in the same chair, in the same position, every day, all day for many hours. That wouldn't be good for any of us. You will want to remind your resident who is in a wheelchair to shift their weight appropriately every few minutes to avoid pressure areas. Always use physician-prescribed cushions, pillows, etc. to help support the resident. We always want to make sure that when the resident is seated in the wheelchair that their buttocks are all the way to the back of the chair and their arms are comfortable. Slouching, leaning over in a wheelchair is never comfortable for someone. If the resident is incontinent and also fully dependent upon a wheelchair, this even increases risk factors for pressure sores. So you will want to follow the resident's service plan carefully regarding their incontinent care. Skin checks are critically important. If a resident is using a wheelchair frequently, we will always want to check their skin daily. Not just their buttocks and back areas, but all bony prominences, including the heels. If you notice that redness continues to appear in one particular area, observe and let your supervisor know. It could be that the wheelchair is a wrong fit, or it needs to be padded differently. There are other concerns we have when someone is in a wheelchair for long periods of time. Watch for any edema or swelling, especially in the lower legs or feet area. Watch for change in color of skin. Also note any bruising or any other changes that you think are important for your supervisor to be aware of. Remember, it's a good idea to report all changes. Many residents are able to transfer independently from their wheelchair to bed, chair, etc., and back to the wheelchair. Some will use transfer boards that they actually slide or scoot on, while others will require full assistance.
Mobility scooters. Mobility scooters are a popular alternative to a power wheelchair. In many people's eyes, they are more attractive and less medical in appearance. Mobility scooters typically have a seat at the rear of a wheeled platform with a seat that will often pivot to facilitate ease of entry and exit. The controls and handrest are on a column in front of the seat, and they steer much like a bicycle. Scooters may have either 4 wheels or 3, 2 in back, 1 in front. Mobility scooters are ideal for outside activities as they glide smoothly and easily over a variety of surfaces. One of the most challenging aspects of mobility scooters in the assisted living or residential care community is the balance between encouraging independence and mobility and resident safety. As a resident's mental or physical capabilities decline, an increase in mobility scooter accidents can occur. Administrators may face many challenges and need creative solutions to make sure all residents are safe and to also respect the independence that a mobility scooter can provide to a resident. Scooters, administrators' challenges. Here are just some of the challenges that many administrators may face, such as how do we maintain safety for all residents if a specific resident's driving skills are posing a risk to other residents? Here are a few ideas. Make sure your admission agreement contains house rules to address this situation. Some communities require all residents to observe a certain speed limit. Others require residents who have posed a risk to always be escorted by a direct staff person when driving their scooter. Determine the specific problem. For example, is it backing the scooter up? And create solutions directed to that concern. Direct care staff should be aware and report any dangerous behaviors to their supervisor. Another challenge is how do we maintain an attractive dining room if we allow everyone to drive their scooters to the tables? Here are a few ideas. Make sure, again, your admission agreement contains house rules to address this situation. Some communities may require all residents to park their scooters outside of the dining room and then be escorted by staff to an individual table. Now, this situation is a challenge since residents have a right to their mobility device to maintain their independence, and administrators have a right to protect the safety of all residents. Direct care staff should be aware and report any dangerous behaviors to their supervisor. Walkers. Walkers are ambulatory aids that help individuals increase mobility while walking and decrease the risk of falls. Walkers can help improve functional independence, which is so important for our residents. In general, walkers can be categorized into 3 different types. There's the standard walker without any wheels, the front-wheeled walker with 2 wheels, and the walker with 4 wheels, sometimes called a rollator. Standard walkers have 4 legs with rubber stoppers on each leg. Standard walkers are height adjustable and are used for adults in a normal weight range. Standard walkers are the safest ambulation assistive device currently used. However, the resident must be strong enough to lift the walker and to step it forward as he or she walks. Front wheel walkers have 4 legs with 2 front wheels on the front. Front wheel walkers are used for individuals who do not have the strength to lift the walker. If desired, the majority of new standard walkers can be converted to wheeled walkers by purchasing compatible front wheels. Although front-wheeled walkers are easier to push, they are not as safe as the standard walker without wheels. Front-wheeled walkers can easily slide and tip, causing a resident to lose his or her balance. Four-wheeled walkers also called rollators, are characterized by 4 5 by 8 inch wheels. 4-wheeled walkers have wheel brakes that operate similar to bicycle handbrakes. The wheel brakes lock for safety by either pushing down or pulling up. 4-wheeled walkers generally have a padded seat with a backrest. Four-wheeled walkers do not require the lifting of the walker that a standard walker requires. However, they require that the resident be strong enough to control it. It's also important that residents have the cognitive ability to use a walker, especially a four-wheeled walker that must be secured by engaging the brakes. So, as a caregiver, you might have concerns that you should bring to your supervisor's attention about a resident's ability to safely use a walker. Walker accessories. The majority of walkers have a wide variety of accessories available. There are walkers made with built-in seats, extra lightweight, extra wide, and walkers for individuals who have suffered from a stroke. There are walker baskets and trays available to help individuals carry necessities from one place to another, drink carriers, leg gliders, pouches, and more. Walking tips. Residents should be encouraged to maintain proper body mechanics when using his or her walker. The resident should push or place the walker slightly ahead of him or herself, then step into the walker. That pattern should continue. Walker slightly ahead, then step into the walker. A key point is to make sure the resident never has the walker too far ahead of him or herself to maintain safe ambulation. Also, to assist in maintaining good body posture, have the resident look out in front, not at his or her feet. Let's talk about an independent transfer into a walker. If a resident is sitting and wishes to independently transfer into his or her walker, here are some suggestions. The resident should place the walker directly in front of the chair. The resident should move forward in the chair and use the arms of the chair to push him or herself into a standing position. Once standing, the resident can switch his or her hands to grip the walker. Be sure the resident stands for a minute or so until he or she feels stable and balanced. Here are a few tips for walker safety. Make sure the brakes are on if applicable when a resident is transferring from a chair or bed to the walker. If you notice that the brakes are not working properly, always alert the resident and then tell your supervisor so it can get properly repaired for safety. This may mean the resident may not be able to use that walker temporarily, and we might need to provide additional assistance. Make sure the walker is close and properly positioned to not tip nor roll away when the resident transfers to the walker. Always make sure the walker is within reach of the resident. Never take a walker out of reach where a resident would have to walk unassisted to get to it. Other walker safety tips: encourage the residents to stand up straight and stand within the handles of the walker as they ambulate. If the walker gets too far out in front, it can scoot away from them. Make sure the nuts and bolts on the walkers are tight. If you notice a wobble, alert the resident and tell your supervisor so the walker can get properly repaired before an accident occurs. And again, we might need to provide additional assistance while the walker is being repaired. Direct care staff should never change the height or make other adjustments to a resident's walker. If the resident is having difficulty, have them discuss this with their physician or physical therapist, and we may need to contact the doctor or physical therapist on their behalf. Direct care staff should never add accessories, such as roller wheels or glider feet or balls placed on the legs of the walker. Again, the resident should discuss the requested changes with an appropriate medical professional. We may also contact the medical professional for them. If the resident has accessories such as a bag or basket on the walker, make sure the resident does not overload it and cause the walker to become unstable. Never push a resident who is sitting in his or her walker. Four-wheeled walkers can easily tip over backwards. Residents have been severely injured and have died from head injuries occurring from direct care staff pushing residents in a walker. If the resident can no longer walk while using his or her walker, transfer the resident into a wheelchair. You may think it's quicker to have the resident sit while you're pushing them, for example, to an activity or the dining room. But as we mentioned previously, this can be very, very dangerous and should never be done.
Under no circumstances should you ever misuse a mobility device. Devices have very specific purposes. We should never deviate from those purposes. A very common mistake that is observed is using a walker as a wheelchair or scooter. Even though a resident or family member may ask you to transport a resident in such a fashion, never do that. That is very dangerous. When the resident goes over a threshold or even just scooting along the floor using it as a transport device could result in significant harm.
Canes. Walking canes are great mobility aids for individuals that don't require the full assistance that a walker can provide. Generally, a cane is meant to assist in balance and coordination. In some cases, a cane can assist the user in getting up and supporting weight on one or both of their legs. Canes can certainly be decorative and over the years have shown a variety of styles. The golden era of canes was from 1550 to 1930. Canes were a reflection of the culture, and a lady and gentleman never went anywhere without a cane. Back then, people didn't use a cane for walking support, they wore their cane. Thus, canes were often built for fashion, but not to support a person's weight. Today, carrying a cane is not in fashion, and most canes are used for support. Thus, they must be strong and secure. In the assisted living or residential care environment, you will most frequently see single-point canes and quad or four-point canes. A support walking cane must be able to support the resident's weight. The shape of the handle must be comfortable and allow the weight to be directly over the shaft. The thickness of the shaft must be sufficient to support the user's weight without bending or bowing, and it should be approximately as long as half the height of the user. Rubber tips are on the bottom for safety. The quad walking cane has a four-tip design that gives the user even more support. Cane use. The resident should always carefully follow the instructions provided by his or her physician or therapist for the use of their mobility device. Generally, if a resident is using a cane for stability, he or she may grip it in either hand, whichever is most comfortable for the resident. If a resident is using a cane because of a weakened leg, generally the resident's healthcare professional will instruct that the cane should be held in the hand opposite from the affected or weakened leg. The resident should pick up and move the cane in unison with the affected leg while bearing weight on the stronger leg. For example, if the right leg is weaker, the cane should be used in the left hand to counterbalance the weakened leg and provide greater stability. A common misuse of the cane is to hold it on the weaker leg side. That is incorrect. Here are some suggestions for a resident who uses his or her cane to assist in transferring to or from a chair or bed. To sit down in a chair while using a cane or quad cane, the resident should back up to the chair until both legs are touching the seat. Then use the armrest to slowly lower him or herself into the chair. The cane may be placed to the side of the chair during this procedure. When rising, the resident should pick up the cane and place it in the hand on his or her strong side. Then, with both feet squarely on the floor in front of the resident, reverse the process by having him or her push up on the armrest. After rising, The resident should stand for a minute or so to make sure that they're stable and balanced before walking forward. Cane safety tips. Here are some tips to assist the residents who use a cane. The bases of most quad canes are flat on one side. The two legs on the flat side are approximately parallel to the shaft, while the two legs on the opposite side extend outward for greater stability. It is very important that the cane should be used with the flat side toward the user to prevent tripping. Make sure your resident is using his or her cane properly. Some other safety tips: encourage the resident to maintain good posture and stand up as straight as possible. Encourage residents to take small steps. Too large of a stride can reduce stability. If using a quad cane, all four legs should contact the ground evenly. The resident should avoid tipping the cane. The center space of the quad cane's foreleg should land even with the instep of the opposite foot. The resident should place the cane firmly on the ground before taking the next step. Additionally, regularly inspect the rubber tips on your resident's canes or quad canes. Worn or damaged tips should be replaced immediately. Also check that the hand grip is securely fastened. A loose hand grip that could slip off or rotate during weight bearing can cause a fall. Make sure the resident is wearing shoes that are safe, sized correctly, and have a non-slip sole. Always make sure the resident's cane is within reach. Never allow the resident to ambulate without his or her mobility device. Another safety tip is never make adjustments to the resident's cane or any other mobility device. If the resident appears to be having trouble or you have a concern with how the resident is using his or her mobility device, suggest the resident make an appointment with their physician or therapist or contact that resident's healthcare professional yourself.
Many of your residents will use walkers, and there certainly is a large variety of styles of walkers. There are 4-point walkers, front-wheeled walkers, tripod walkers, just to name a few. That's why we stress the importance that you need to understand the mobility device that your resident uses and the specific requirements with the use of that device. But let's talk about general use of walkers. We always want to make sure the walker is nearby so the resident has it easily within arm's reach if they are getting up on their own. A resident should always have a walker that has been properly fitted. A walker that is too high causes the resident to walk improperly, as does a walker that is too low can cause unnecessary stooping and will not provide the necessary support the resident may need. When assisting with a walker, you will want to stabilize the walker while the resident stands up and has a firm grip, should they require that level of assistance. Never rush a resident who is using a walker. Follow physician guidelines regarding the amount of assistance the resident will require. Oftentimes, you will simply just walk next to the resident while they're ambulating with their walker. Never pull or tug on a walker, causing a resident to walk too quickly. You may notice a variety of styles of canes. Some of them are very decorative and the residents actually individualize the look of their cane. There are straight canes that are simply a single point cane. Now these type of canes typically only support about 8 to 12% of body weight. So if a resident requires a greater level of stability, they will probably use something called a quad cane or a 4-point cane. Again, make sure that the cane is always within easy reach for the resident to use. A resident should never use their cane to stand up, but rather learn a good safe technique using the arms of their chair. Always follow the advice of the physician or physical therapist working with your resident.
Crutches. Crutches typically are used when a patient is injured or disabled anywhere below the waist. They provide a person with extra stability to enable normal movement. Two common types of crutches are forearm crutches and underarm crutches. Forearm crutches are used most frequently by people with permanent disabilities. Forearm crutches are used by slipping the arm into a cuff and holding the grip. Underarm crutches are used most often by people with temporary injuries. These are used by placing the pads against the rib cage beneath the armpits and holding the grip, which is below and parallel to the pad. Use of crutches. Most often, if a resident is using crutches for stability, he or she has received instructions from his or her physician or physical therapist. The resident should always carefully follow the instructions provided by his or her physician or therapist. Never make adjustments to a resident's crutches. If you have a concern that the resident is not using their crutches properly, discuss it with your supervisor and the resident's physician or therapist. Always make sure the resident crutches are within reach. Do not allow the resident to ambulate without his or her crutches unless instructed otherwise. Gait belts. Gait belts are safety devices to assist a resident to move from one place to another. A gait belt helps direct care staff support residents and move them more safely than simply holding their hand or arm. There are several types of gait belts. All gait belts securely buckle and may range from 1.5 inches to 4 inches in width. Some gait belts have handles, others do not. When putting on a gait belt, you should place the belt over the resident's clothing with the buckle in the front. It should be just snug enough that you can get your fingers underneath. When transferring or assisting the resident, you place your fingers between the gait belt and the resident, using an underhand motion to grasp the gait belt. When using a gait belt, use good body mechanics and a rocking and pulling motion rather than attempting to lift a resident with the belt. If assisting the resident to stand, ask the resident to stand as you lift him or her using the belt for grip. Continue holding on to the belt as you guide the resident during the transfer. Here are a few safety tips when using a gait belt. A layer of clothing should always be between the gait belt and the resident. Gait belts should not be used for lifting residents. They are used to assist the resident to transfer or ambulate. Gait belts may not be suitable for ambulation of heavy residents or residents with abdominal or back injuries. Always use good body mechanics when using a gait belt, just like you should at all times when you are lifting. Do not use a gait belt as a substitute for getting additional help. If the resident is too heavy or unstable for you to safely transfer, always get a second person to assist. Psychosocial considerations. In addition to caring for the physical needs of residents, it's also important to consider their psychosocial well-being. For many residents, using a mobility device is a sign of weakness or failing health. It's important to always make sure the resident is safe and using the devices prescribed by their healthcare professionals.
During this training period, we have discussed a lot regarding the care of our residents with the use of wheelchairs, walkers, and canes. But you know, there's another aspect we always want to remember. Besides the physical care of our residents, we want to always think about the psychosocial care of our residents as well. For many residents, a newly prescribed mobility device is frankly a source of embarrassment or shame. They somehow feel that they are not as strong as they once were. They somehow feel that they are less a contributor because they're reliant upon a device. Treat the use of an assistive device as a very matter-of-fact occasion. Point out to the resident that many other people use mobility devices and they are truly for their benefit and safety. Now, should you have a resident that continually refuses the use of their mobility device, always notify your supervisor so that the physician can be aware the resident is not using the prescribed device appropriately. Now remember, use of mobility devices is not just in the resident's room or just when we escort them to the dining room, etc. It's a part of everyday living. So if your resident is going on an outing, we want to make sure that mobility device is going along as well. Work with your activity leader. Discuss the need of the mobility device with other staff members in the community so they're all aware the residents are using their devices appropriately.
Back safety. Residents who use mobility devices will often require assistance from a direct care staff for transfer. It's important for direct care staff to use proper lifting techniques to prevent back injuries. The next several pages contain a summary of back safety tips. Some general principles of back safety. Exercise plays an important role in keeping your back strong, healthy, and flexible. Taking responsibility to keep yourself fit and strong is the most important injury prevention tip. Do not reach for or lift objects over shoulder height. If necessary, get a ladder to lift objects that are too high. Keep the object as close to your body as possible while lifting it. Do not attempt to lift more than what is safe for you. If you need help, get a second person to assist. Some other general principles for back safety include: do not bend over and use your back when lifting. Always bend your knees, squat down, and lift using your legs while keeping your back straight. Get as close to the object as possible. Obtain a firm grip. Have your feet about shoulder width apart. Lift slowly, using your leg and arm muscles to lift, rather than pulling with your back. Never jerk to lift an object. Keep your head up and look straight ahead while lifting. When assisting a resident to sit or stand, make sure you keep the resident informed of what you are doing. Have the resident assist you as much as possible. For example, if you are helping a resident out of a deep chair, sofa bed, etc., have the resident scoot forward toward the edge before you begin to lift. The resident may be able to push off the arms of the chair or edge of the bed while you assist him or her to stand. Coordinate your efforts by telling the resident to push on the count of 3. 1, 2, 3, push, for example. Be sure to hold on to the resident until he or she is stable and balanced. When assisting a resident, always follow all of the general back safety principles we have just discussed. Wheelchair transfers. One of the most common transfers you may do with a resident is to or from a wheelchair. It's always important to make sure you practice the back safety principles we've just discussed. In addition, there are a few specific recommendations when transferring to or from a wheelchair that can promote safety for both you and the resident. Assisting a resident to transfer. If moving to a wheelchair, position the wheelchair at a 45-degree angle to the bed or chair on the resident's strong side. Be certain the wheelchair is close to the bed or chair. Remove footrest or rotate them out of the resident's way, and always lock the wheels. After assisting the resident to stand, steady the resident as he or she turns to prepare to sit in the wheelchair. Allow him or her to touch the seat with the back of the legs. Encourage the resident to steady him or herself with the arm of the wheelchair. And of course, you want to take this very slowly, allowing the resident to feel secure with the transfer. Lower the resident into the wheelchair as you bend your knees. Check to be sure the resident is in proper alignment with his or her feet on the footrest in the wheelchair. Always let the facility supervisor know if a resident has a problem with the transfer including but not limited to weakness, dizziness, or pain. If you're assisting a resident to transfer from a wheelchair to a stationary chair or bed, basically the steps we just reviewed are the same. Whenever assisting a resident to transfer, be sure you practice the back safety principles we've discussed. Remember to bend your knees and use your legs and arms when you need to lift or assist a resident. Never bend over and use your back to perform the lift.
You have reached the end of this lesson. To exit this course, click Exit in the upper right-hand corner.
Before we begin the course, please take a moment to review this important notice. After you've reviewed the notice, click the Next button to continue.
Course description. Many residents in assisted living or residential care are able to walk or remain mobile with the use of ambulatory aids. Ambulatory aids are devices that residents use to help them move safely and independently. The common ambulatory aids used in assisted living and residential care that we discuss are wheelchairs, scooters, walkers, canes, crutches, and gait belts. We learn about the different types of devices, how they should be used in a safe manner, and ways that direct care staff can assist the resident with the use of the device.